Hello everyone. Have a nice day, especially to our instructor, Sir Kinmark Idulan. So today our topic is all about COVID-19. So anyway, I am Group 12. So I am the first reporter. So first, what is COVID-19? So COVID-19 is a coronavirus disease 2019. Is an infectious disease caused by severe acute respiratory syndrome. Coronavirus 2 SARS-CoV-2, previously known as 2019 novel coronavirus 2019 nCoV, a strain of coronavirus. So kaning COVID-19 usa kani siya nga sakit nga makatakod o gitawag na siya before og coronavirus og usa ka strain sa coronavirus. So second is the first cases were seen in Wuhan, China in December 2019 before spreading globally. So the current outbreak was recognized as a pandemic on 11 March 2020. So kani siya nga case nakita sa Wuhan, China. In short, didto ni siya gagikan before siya mispread sa kalibutan. Og karon nag-outbreak also known as pandemya adtong March 11, 2020. So the last one is the COVID-19 virus spreads primarily through droplets of saliva or discharge from the nose when an infected person coughs or sneezes. So it's important that you also practice respiratory etiquette, for example, by coughing into flex elbow. So, ang COVID-19 pinaagi sa pagtulo sa laway, pag-ubo, pag-atsi, makatukod na siya maong sa una ginadisiplina gyud ta nga dili maggawas-gawas ug naay gitawag nga home quarantine once na atay gipamati or kung asa man tagikan gina-separate gyud ta sa atong pamilya.
Good day, sir. I am Jessie Miss Roma, the next reporter. So my topic is all about terminology. So what is terminology? Terminology is the body of term used with particular technical application and subject of study, profession, or etc. So the WHO or World Health Organization originally called this illness novel coronavirus infected pneumonia or NCIP, and the virus itself had been named 2019 novel coronavirus or 2019 nCoV. On February 11, 2020, the WHO officially renamed the clinical condition COVID-19, shortening of coronavirus disease 19. Coincidentally, on the same day, the Coronavirus Study Group or CSG of the International Committee on Taxonomy of Viruses renamed the virus Severe Acute Respiratory Syndrome Coronavirus 2 or SARS-CoV-2. The official virus name is similar to SARS-CoV, the virus strain that caused epidemic severe acute respiratory syndrome or SARS in 2022 to 2024, potentially causing confusion. The WHO has started it will use COVID-19 virus or the virus that causes COVID-19 instead of its officially named SARS-CoV-2 and dealings with the public.
Good morning, sir. I am Ronalisa Sampayan, the third reporter. My topic is epidemiology. So first is, what is epidemiology? Epidemiology is the study of distribution and determinants of health-related states among specified populations and the application of that study to the control of health problems. As of 31 March 2020, 754,948 cases of COVID-19 have been confirmed worldwide. having been diagnosed in 203 countries with 36,571 confirmed deaths. There are 9 countries with 10,000 confirmed cases and 27 countries with between 1,000 and 10,000 confirmed cases on 27 March 2020. The USA surpassed China as the country with the most confirmed cases. The RO basic reproduction number or of SARS-CoV-2 has been estimated between 2.2 and 3.28. That is, each infected individual on average causes between 2 to 3 new infections. The incubation period for COVID-19 was initially calculated to be 5 days, which was based on 10 patients only. An American group performed an epidemiological analysis of 181 cases for which days of exposure and symptoms onset could be estimated accurately. They calculated a median incubation period of 5.1 days. That 97.5% became symptomatic within 11.5 days. 8.2 to 15.6 days of being infected, and that extending the cohort of the 99th percentile results in almost all cases developing symptoms in 14 days after exposure to SARS-CoV-2.
Good afternoon, everyone, especially to you, sir. I am Marcris Balani Ponce, the third reporter of COVID-19 epidemiology. Muni sumpay sa report sa third reporter. The number of death from COVID-19 is 36,571 on 31 on March, with a case fatality rate of 2 to 3%. It is speculated that the true case fatality rate is lower than this because many mild cases are not being tested, which thus skews the apparent death rate upwards. The paper is published by the Chinese Center for Disease Control. The prevention analyzed all 44,672 cases diagnosed up to 11 February 2020. Of these, 2.2% were asymptomatic and 80.9% were classed as mild. Another study looked at clinic characteristics in COVID-19 positively tested close contact of COVID-19 patients. Approximately 30% of those COVID-19 positive close contact never developed any symptoms or changes on chest CT scan. The remainder show changes on CT, but 20% reportedly developed symptoms during their hospital course. None of them developed severe disease. This suggests that a high percentage of COVID-19 carriers are asymptomatic. In the Chinese population, 55 to 60% of COVID-19 patients were males, and the median age has been reported between 47 and 59 years. Children seem to be relatively unaffected by this virus, or indeed other closely related coronaviruses, with large cohort studies reporting that 1 to 2% of COVID-19 patients are children. That's all.
Good day, sir. My name is Michael Simirontos, and I am the fourth reporter. So, COVID-19 typically present with systematic and or respiratory manifestations. Some individuals infected with SARS-CoV-2 are asymptomatic, so meaning wala sila bation na symptoms and can act as carriers. So, bisag wala sila sintomas, makatakod gyapon sila. Some also experience mild gastrointestinal or cardiovascular symptoms, meaning ang uban makabati sila og ubo, ang uban po wala, asymptomatic sila. Although these are much less common. So common fever, so sa fever hilantan ka 85 to 90%, ubo, cough 65 to 70%, fatigue meaning kapoy mong lawas 35 to 40%. Less common myalgia, arthralgia 10 to 15%, headaches 10 to 15%, sore throat 10 to 15%, and chills 10 to 12%. So, nausea. Nausea is kana siyang naman siya mga symptoms ng nausea is kanang sipon, magbahing ka, vomiting, kanang kasukaon, o nasal congestion, meaning arat imong tutunlan, o diarrhea, kanang kalibanga, palpitation and chest tightness, so palpitation kanang paspas mo beat imong heart, kanang kulbaan ka, then chest tightness, kanang mahugot ang imong dugan. So, pediatric. In the main, the clinical presentation in children with COVID-19 is milder than in adults. So, mas mild ra ang mga bata compare sa adults. Symptoms are similar to any acute chest infections, encompassing most commonly rhexia, dry cough, sore throat, sneezing, myalgia, and lethargy. So, kaning rhexia kay isa ni siya sa kani siyang hilanat, kanang init imong lawas, body temperature mataas, so dry cough, kanang gahay na ubo. And then kanang sore throat kay kanang arat imong tutunlan, sneezing kanang magbahing ka. Diri sa sneezing muna siya muna siya pamaagi na makatukod ang kaning COVID na virus sa pamaagi sa pag-sneeze. So wheezing has also been noted. Other less common, less than 10% symptom in children included diarrhea, lethargy, rhinorrhea, and vomiting. So that's all, sir. Thank you.
Good evening, everyone. Our topic is evening is the Dia disease. The corona, any is the one of the immunological history, is of the biological factors, immunological history. Number one, story or travel of the residents as communities. We are just report within 14 days. Further is the windsay of the disease. Number two is conduct which viral RNA positive people within 14 days prior disease onset. In the contact with advantage, how have fever or respiratory symptoms from the immunities confirmed cause reported within 14 days before the disease onset. So, there be all the allergical features, fever and respiratory symptoms. Number two, image characteristics. Number three, white is blood, yellow as normal, disease with physical disease. We see severe respiratory infection which over the abuse cause. So, diagnosis, the definitive test or SARS COVID is the real time works in the transportase polymerase chain reaction, and is believed to be the highest scientific, highly scientific, but the sensitivity referred as low and 67 point, and the highest 95 97. Thus, false and negative are the electrical problem, and several negative antays might be is the required is single cause to be convinced about oxiding disease. So all, thank you.